United. I'm Roxanne Wells, Director of Communications and Workplace Giving for United Way of St. Lucie County. Our mission at United Way is to improve lives by mobilizing the caring power of our community. And we do that through volunteers, donors, and also our agencies. And today we have our wonderful guests from formerly the Homeless Family Center, and it's now the Hope for Family Center. We have Mary Ellen Maguire, Executive Director, and Kim Stewart, Director of Development and Marketing. Welcome, ladies.
Thank you, Roxanne, for having us.
Thank you for coming on the show with us today. To begin with, why don't you just share the mission of the Hope for Families?
The Hope for Family Center strives for families to achieve self-sufficiency through earning a living wage and becoming independent in their own goals.
And we know so many families struggle with this. Over a third of our community here fits into that category of folks who are working, who are just struggling to make ends meet.
Correct. We have over 400 families in the state of Florida who are struggling with homelessness.
That's amazing. And what programs do you currently offer?
We have a variety of programs. We offer residential. Right? We have life skills and vocational programs. We also have a very comprehensive children's program. We serve on average about 50 to 60 children a day and have about 84 people living there. So all of our programs are conducive in helping the whole family get well. We offer ancillary programs such as our medical clinic and the college classes, and our thrift store actually has an entrepreneur program. We have dental and vision and people who donate their time to help.
Very comprehensive. Now, for example, if someone finds themselves in a situation that they are homeless, how would they get with you and get services?
Well, the first thing that they would do would probably be to check with our intake folks, and they would run them through a series of questions and try to determine what their specific needs were, how many children they have, because we really only work with families, and so having children is a major requirement. They have to go through a series of different intake questions for substance abuse and take breathalyzers and drug screening and all of that.
It truly is a program. So when people are assessed to come in, it's really important that they're committed to the journey, right? Well, you'll trip along the way, and we know that. We'll want to help you get up on your feet and keep going. So that part of that assessment piece is really important to see what the commitment level is.
Now, in terms of your emergency wing, where it's a 90-day stay versus your transitional services, so how often do you have folks on the waiting list for that emergency 90-day?
Always. There's at least 15 qualified families that are always on our waiting list, and we only have 21 rooms.
And they are living in cars or living with other family members or homeless altogether?
What do they call it? Couch hopping, I think?
Yes.
Because they don't, there's a big difference between chronic homelessness and the
Family
one paycheck away from homelessness that we, deal with on a regular basis.
Yes.
And we offer shelter, but we're really not a shelter, so we do try to bring the families we have to become self-sufficient and earn their living wages, as Mary Ellen said, as quickly as possible so that they will be successful in being self-sufficient. There's always a lineup of more families to come in, and so it is a process.
Yes, and such comprehensive services you offer. Tell us a little bit about your medical clinic. That was new to me. I know in St. Lucie County we do have a medical clinic for those that are underinsured and uninsured. So tell us a little bit about...
Whole Health Family Center, Whole Family Health Center, I always confuse those two words. Dr. Perone and his group come in Tuesday evenings. And we do that purposely so people don't have to take the day off from work to go see the doctor. The other goal that's being met here is people are actually building relationships with doctors. And so what we see now is, let me just step back. They've seen over 200 people at the clinic on our site. We just host it. He does the work. And so what we see now are families preparing for the doctor visit, right? They're building that relationship, so they go, oh, I've got to ask Dr. Braun about, how he was behaving this week, if his
Right.
medication was correct. And the other thing that Whole Family Health Center offers is they will give the medications for free as well.
Wow.
They have a pharmacy in-house. So this has turned out to be a great benefit, not just for our residents, but if you are homeless or way below at the poverty line and less, you can call the center and he will schedule you in.
That's great.
We
Yeah.
actually just did a recent extra clinic where they offered the flu shots.
Oh, wow.
So people could come in and have that.
And it is so important to have that evening, the accessibility of seeing the doctor and not having to take off work and keep your children out of school.
Absolutely.
Well, another element that I don't think people always think about, and I come from the hospital industry, and it's the taxpayers' dollars that go into
Yes.
funding the insurance and whatnot. And when people go through a process of preventative care,
Yes.
it eliminates the need to be taken into the emergency room, which costs everybody else significant money. So if we
Yeah.
can help in some way to keep people healthy and not have to go to the emergency room through a medical clinic like this, that's in the long run going to help all of us.
That's great. And I hear you have some other fun services coming in. A lady has volunteered to come in and do haircuts, and that's just so great for the dignity and just well-being of everyone there, having those services.
Anything. We actually have a Portraits of Hope that comes in and does Christmas photos. You never
Oh,
think about
wonderful.
having photographs with children.
Well, the most important
They don't
part of
have
that is when you look at that portrait of hope, you see a family and there's nothing about that says homelessness.
Yes.
So the family looks at that and there's an increased sense of pride
Self-esteem.
and self-esteem.
And in fact, that is what is behind your name change recently, yes?
Yes, it is. We, excuse me.
The Hope for Family Centers is something that the kids don't have to feel embarrassed
Yeah.
about when they get picked up at school and the staff has, the Hope for Family Centers as opposed to homeless family.
Yes.
Doesn't have to be highlighted.
It really, we took a lot of thought with the name change, and, we started as the Homeless Assistance Center in 1991, and we're celebrating our 25th anniversary
Great.
this year, which is just so exciting. But there was a lot of thought put into that, and really, it came down to the children. We didn't want to stigmatize the children in any way.
Well, that's great. And I hear about some new interesting things coming with your partners, Indian River State College.
Oh, yes, and the Clemente program,
Yes.
which is a national program, and we're really excited. This is a humanities-based program that really has a way of changing the critical thought process. So you use humanities curriculum. Let's say some of the classics are all about moral decisions, right? So you're
Yes.
studying literature and you're talking about it, and it's really a discussion-based program. And so it really changes the way and they bring real life, changes the way you think about things and what that turnaround is going to be. So we're really excited about it. The Clemente model was just awarded the National Humanities Award by the President. They went
Wow.
up to Washington last week, and they just received that honor, and we are so thrilled to be their partner.
Yes, that's wonderful. And I was just visiting on Monday,
Yes.
doing a tour, and you have so many residents that are enrolled at Indian River State College, achieving their dreams and looking for further education, as well as I saw folks doing filling out applications and research on the computer. So it's really great
I think
to
we
see.
have a 90% of our adults are actually taking college classes, and also they're all required to hold down a job and to put aside 75% of their income while they're at the center,
That's
so
right.
that they'll have something to start off with when they are launched
And
back into.
it's so important, especially with the education aspect, because knowledge
Very.
really is power.
And it also creates good behaviors, right? So you're doing your homework on time, you're getting to class on time, and it really,
Being accountable.
yes, and it provides moments of success. So we're really excited about
And
it.
speaking of class, talk about your kids and the program that was so generously donated to you
Yes.
by a gentleman in the community for your kiddos.
Yeah, we're really excited. we were able to serve 80 children in summer camp this past summer. And the generous donor actually has come together with his friends to create the Homeless Children Foundation. And they've committed to next year as well. And what we're able to do is help, we helped 6 other agencies in the community through this funding identify people who needed summer camp and other enrichment activities for their children. And so we're really excited about that.
That's
80
great,
children.
not only to combat summer learning loss, but also to help those families, allow them to be able to maintain employment. It's hard to know what to do with your children during those
And
months.
it's enrichment for the kids, because the kids need those activities in the summertime.
And
They don't-
And the
socialization.
structure and all of those things are so powerful for a child.
And any new programs coming along beyond the Clemente, or?
Well, the Clemente is the big one. We hope to get that off in January. And here's the exciting news, if anyone is interested. With Clemente, you get college credit, 6 college credits from Bard College out of New York. Indian River College, State College is hosting that through Bard. So what, you don't need your GED to get into this, right? We want you to come and have the experience. So if anyone is interested, and they live struggling with their finances and are struggling to keep a roof over their head, we welcome you to come and apply and be part of this learning opportunity.
Wonderful. And tell us a little bit about the thrift store. Such a fun place. I visited. Lots of.
Actually, if you're ever looking for furniture, you wouldn't really know that it was a thrift store. It's everything's very clean and very well structured and laid out, and I've had a lot of people who have had nothing but rave reviews about the things that they've been able to get there. We actually, being a thrift store, won an award for one of the best consignment shops.
Wow.
And we're not a consignment shop.
Right.
So, but the thrift store allows us to support the Homeless Family Center, which is now the Hope for Families Center. You know,
Jobs and training.
Jobs and training with our apprentice program.
And it's a resource also for your residents.
Absolutely.
It's a resource for the residents when they're getting jobs out in the outside
Or when they
community.
move out, we're able to supply them what they need for their home. Furniture, pots and pans, all those things. Donations are very much very important. Volunteers are very needed. We will go and pick up your furniture, and we have delivery options as well. So if people are interested in delivering, they can call the center, and we will be able to make
a trip
income
out to pick it up.
Any other ways one can volunteer?
You know, we have the children's program, which is always needed, but we also need tutors available for adults, right? For those who are going through their GED or taking some, I don't know, when I took my first math class in college, I thought I was just going to die, right? So you want to be able to, so we need that kind of support for adults as well.
Yes, of course.
And there's always times to come in and cook and work with our residents just by being there and somebody to talk with.
I also think what's really nice is if people want to come to the center and take a tour like yourself, they walk through, they kind of get a sense of what tugs at their heartstrings. Where can my skills help this organization and the families that are here? So we always offer at 4 o'clock on Wednesdays a Wednesday walk tour. And the reason we keep it to one day is because we try to allow the residents the privacy and the peace that they have in their
Yes.
home. We will make concessions if it's really necessary, but we really do try to keep to that 4 o'clock
Yes.
on Wednesdays for a
Like
tour.
when your United Way rep comes and makes a surprise visit.
I'll be there in a half hour. It's 8:30. Okay.
And there's always other ways to help. I just received your wish list for both things that the residents need, the things that the center needs, school supplies, all kinds of basic things that if someone were to want to do a drive or contribute,
Yes.
you always have needs, and that's available on your website.
Correct. You know, people think of school supplies in August and September, but we have people coming in all through the year, and kids that, and when you're living in your car, you don't have school supplies.
Of course.
So all of those things are important to us all year round.
Wonderful. Well, thank you, ladies, for joining me. This has been a wonderful and enriching time to learn about what you're doing in serving our residents.
Thank
Thank
you
you.
so
Thank
much, Roxanne.
Take my hand and start a brand new day. And together as one we'll start to see some change.
Underneath everything we are, underneath everything we do. We are all people, connected, interdependent, united. And when we reach out a hand to one, we can influence the condition of all. That's what it means to live united.
And welcome back to Live United. This time on our second half of the show, we have some of my favorite folks from Hands of St. Lucie County. We have Dr. Andy Passeri, Executive Director, and Sydney Liebman, and she is the Director of Development. Welcome.
Thank you.
Thank you for having us.
Tell us a little bit about Hands.
Well, Hands was formed out of need, for one thing. There is a healthcare crisis in St. Lucie County, and several folks got together back in 2006 and started holding monthly meetings, trying to decide how to tackle that healthcare problem in the county for folks who don't have health insurance or are homeless or are unemployed. And it took them a while, but after 4 years of persistence, they were able to finally open the Hands Clinic, and they were able to do it with a huge, huge group of partners.
And that's wonderful. And you're serving how many St. Lucie County residents now?
At any given time, we have approximately 3,500 patients on board, but in St. Lucie County, there are more than 65,000 uninsured adults.
That's just amazing. And what does HANDS stand for?
Health Access Network Delivery System.
And it takes many hands to deliver that, doesn't it?
Yes, it does. Yes, it does.
And what kind of services do you provide?
We have a breadth of services. The first is medical, of course, general medicine, with referrals to specialists, both in the clinic and at their offices. But these are partners, folks who've signed on to be volunteers. We have a dental program, an adult dental program, and we have a pediatric dental program, not in the clinic, but in the school system, which is a separate program. And I'll talk about that. I'd like to talk about that a little bit in a moment. We also have mental health programs. We have psychologists on staff who will see patients for mental health issues. The point is, many people suffer from chronic diseases, non-emergent chronic diseases or non-emergent diseases. And the alternative for these people would be the emergency room, a place where they ought not to be because it is inappropriate to be in an emergency room for a non-emergent disease, but they have no other choice. And what it does is it clogs up the emergency rooms. The hospitals begin to shoulder additional costs, not reimbursed, for those patients, and it's a very inefficient way to deliver health care. So the Hands Clinic is an alternative for that.
That's great. And how does one apply for services or know if they qualify?
Well, there are a few qualifications, and they can actually do all of it at our website, which is handsofslc.org. Number one, they have to be an adult between the ages of 18 and 64. They have to have been a resident of St. Lucie County for at least 6 months. There are income requirements, 200% or lower of today's poverty level. And that poverty level depends on how many people are in the family.
Right.
They have to be able to show identification, proof that they are not eligible for Medicaid. So there are a few steps that they have to take. We have navigators on staff that guide them through that process. And usually if folks come to the clinic with all of their paperwork ready, those navigators are able to process these patients right away, and then they're able to see a doctor right away.
And perhaps even navigate them towards, if they do qualify for government-funded insurance as well, which is sometimes hard to navigate. The average person, it's very difficult to...
It is.
Right, extremely difficult.
As even access to computers and whatnot.
Sure.
And one of my favorite programs that you offer in partnering with the St. Lucie County School District is your children's oral health efforts.
Yeah, it's kind of a unique program for us, and it's been very successful. Thanks to the United Way, I have to say. The United Way has supported that program specifically through its Standish Grant program, in addition to its core grants for the clinic. But this program is something that they really sponsor and take care of. Basically what it is, it's a dental hygienist who screens school-age children
And he is a superhero in himself.
Yes, he is.
Yeah, Irvin Velson is quite a guy. Speaks 3 languages.
Yes.
Relates very well to children.
Yes.
Brings his portable dental equipment to the school, and he screens about 5,000 children per year. Since its program inception, he's screened about 27,000 to 30,000 children. And the benefits of it are now being very, they're documented, and it's quite obvious.
Yes.
In that, he had seen children 3 or 4 years ago when this program began. And those children would have been in the 1st grade or thereabouts, could have been in preschool, but they were in that area. More than 50% or 60% of those children had dental disease in 70% of their teeth. 70% dental disease. Many of them had no toothbrush. Many of them, or had a toothbrush, they shared it with others. He taught them the appropriate way to brush, gave them the toothbrushes and so forth and so on. We instituted a follow-up program with their parents or guardians to make sure if we found something that through the child program, through the schools, through Medicaid, these children saw a dentist and were taken care of. Well, what's happened over time is he's seen some of those same children again in middle school, because he also screens middle school.
Yes.
Interestingly, the dental incidence of dental disease in those children, those same children, has gone down to about 10%.
That's amazing.
So preventative health is clearly demonstrated here. It shows you the benefits of it. And this is the success of this program. If we can take these children and intervene with them very early, give them the appropriate education and instruction, the fruits of that is less dental disease or no dental disease.
Yes.
A less chance of the concomitant medical problems associated with rampant childhood dental disease, which is cardiac disease, and specifically cardiac disease, although there are others, but that's a major problem. So if we can nip this in the bud, think of it. We have children who are not bothered by pain, that can concentrate. Many of these children were accused of being unruly because they were unruly. Well, they weren't unruly because of that. They were unruly because they were in pain. Many of them didn't know any other alternative but the pain. So these children have become more productive. They're not going to develop secondary diseases along the way.
They're not missing school.
They're not missing school. They're getting their education. So the payoff of prevention is enormous. We need to do more of that across the spectrum in medicine in this country and specifically in St. Lucie.
And I know a cornerstone tool of measuring the success of this program has been the ability and the time to compile all this data. And Irvin just shared with us recently at our board meeting, as he did a presentation for our board members, that you've recently brought on some support staff to help him.
Yeah.
He said, insisted that he could do as many teeth as possible, schools, he could do them all. It was just the other side of that really is the compiling of the data and helping these folks navigate through their insurance.
He's actually added schools this year. So this year, when the school system, when the schools let out, he will have seen over 9,000 children.
And
this
that's
year.
amazing.
Yeah, because he was doing both the clerical and the clinical work, and by moving the clerical work or the administrative work over to 2 part-time staff folks, his freedom up to do the clinical side of it.
And I know that he does many summer camps during the summer. He just never quits.
Boys and girls clubs.
No, he doesn't quit.
Early
He doesn't
learning
quit.
centers.
And in fact, a board member asked, why don't you hire another hygienist? And he said, well, this is the most efficient way that I can, that we can do that, and that's just great. And I know our kids need it. It's such a burden to firstly take off work and school to go visit the dentist. It's very expensive even with insurance. So I know that it's been such a great asset to our kids and our community.
It's been outstandingly successful.
How are you funded?
Well, we had been funded through something called a low-income pool, which no longer exists. It has been replaced by a community partnership grant that was available through ARCA and the state. Unfortunately, we applied along with the many other free clinics and did not receive anything from that application. We have been blessed through the receipt of $300,000 from the county. The county commissioners and the county administrator, Mr. Tipton, have been very generous, understanding the importance and the impact of this clinic in this community, and have given us that money. We have received money from Allegheny, it's $100,000 from Allegheny Franciscan Ministries. We have been promised additional funding from for not-for-profit hospitals here in Martin County.
Wonderful.
We're going to be working with them to fulfill their pledge, and so we're trying to augment the loss of this money, which is not going to be possible in its entirety, even with the generosity of the groups I've just mentioned and the strong effort that Sydney has put into trying to develop a philanthropy or giving program in this county. Because she has been here only a year, there was no database, there was no development program for the first 4 years of this clinic's existence. It had depended solely on the government grant. When I took this job a year and a half ago, the first thing I discussed with the board was the need for a development director, and the fact that we had to wean ourselves off of, I will say, the fickleness of what comes out of Washington these days, trickles down to the state and whatever, and that we had to become self-reliant, as some of the other counties adjacent to us are, like Martin, for instance.
Yes.
So it's a formidable task. Some folks said that that couldn't be done in St. Lucie County. I don't believe that for a minute. I think the people of this county are generous, if not more generous, in their giving through many ways, through their time, effort, and their treasure, as there are anywhere else. So, and it isn't an insurmountable amount of money we're looking for here. I mean, goodness, we're looking for what, between $500,000 and $750,000. I mean, I know it's a lot of money, but in terms of what other charities have been able to raise, it isn't a huge, over-the-top amount of money. It's not an insurmountable goal. It's just very difficult to do when you don't have all of the armamentarium that normally would go with a development program. So Sydney's been trying to put that together, plus go out. Her Julia program that they're working with, and the ladies that are involved in that, are an enormous success. And I want to work with them as the actual conduits in this community, as ambassadors for the clinic and its mission.
And I have seen lots of ladies showing off the lovely Julia. Do you want to tell us a little bit about the Julia
Sure,
program?
I'd love to. So the Julia Project is actually taken out of the pages of a book called The Necklace. And in The Necklace, which is a true story that was created about 10 years ago, some women shared ownership of a diamond necklace. And a friend of mine, Wendy Dwyer, read the book, came to me and said, we can turn this into a fundraiser for a charity. At the time, I wasn't working at Hands yet, but I knew that I was coming to Hands.
Right.
So I asked her to sit tight and wait and let me take on my new position. And so we waited a few months, and we talked 12 local women into joining the cause. They share ownership. I say ownership, they don't really own it, but the necklace was donated to us by Greg Childress of G. Allen Fine Jewelers, and each woman has the necklace in her possession for 1 month out of the year. During that month, though, each woman has agreed that they will raise funds for Hands of St. Lucie County, and they will host some type of an event that will bring new people into our fold, that will allow me the opportunity to come and talk to those folks and teach them about Hands of St. Lucie County. In one respect, it's been PR genius because it has opened doors that would have taken me 2, 3, 4 years to open.
Yes.
And in another respect, it has been a fundraising genius because these ladies in 7 months' time have already raised $92,000.
Amazing.
Our goal was $25,000.
That's
So
just amazing.
we're just pleased as punch.
Well, it's wonderful, and we see it, Julia, all around the community. And thank you for coming and being on our show today and sharing this information about the Hands Clinic. I know it's such a vital cornerstone to our community and for the health of our community, so we thank you.
Thank
Thank you for giving us this opportunity.
Wonderful. And thank you again for joining us on Live United.